Dr. Fauci, probably never heard of him. You did, and heard of him. He's a very fine research, top doctor at National Institute of Health, working hard, doing something about research on this disease of AIDS.
3 decades ago, a mysterious and terrifying plague began to take the lives of people across the world. Before this malady even had a name, it had a fierce opponent in Dr. Anthony Fauci.
There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly.
Today I've come to talk about our nation's efforts to address this vital issue to the health and the safety of all Americans. I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak. First, we must detect outbreaks that occur anywhere in the world. Second, we must protect the American people by stockpiling vaccines and antiviral drugs and improve our ability to rapidly produce new vaccines against a pandemic strain. A pandemic is unlike other natural disasters. Outbreaks can happen simultaneously in hundreds or even thousands of locations at the same time. And unlike storms or floods, which strike in an instant and then recede, a pandemic can continue spreading destruction in repeated waves that can last for a year or more. And one day, many lives could be needlessly lost because we failed to act today.
We literally left this White House a pandemic playbook that would have shown them how to respond before the virus reached our shores. They probably used it to, I don't know, prop up a wobbly table somewhere. We don't know where that playbook went. 8 months into this pandemic, cases are rising again across this country. Donald Trump isn't suddenly going to protect all of us. He can't even take the basic steps to protect himself.
Let's turn to Dr. Anthony Fauci now, a key member of the White House Coronavirus Task Force, director of the National Institute of Allergy and Infectious Diseases, and widely considered the top disease expert in America. Sir, it's an honor to have you here. Thank you.
What I've seen is something unprecedented. Throughout outbreaks, you always have disagreements about how things should be done, but we've never seen the polarization, which is the reason why, as you say, there are many people who are very much encouraging of what I'm doing in the arena of science, and some people that push back sometimes with the extremes that you mentioned, actually with threats. If you just sit back and think about that for a while, how little sense that makes, that someone who disagrees with what you're saying from a public health standpoint actually takes that to the extreme of suggesting violence. We've never had anything like that, at least in the years that I've been involved.
When you have a respiratory illness that can be spread from person to person, and you have something that's global, and you have jet travel, nowhere in the world is completely safe when there's an epidemic raging in one part of the world. And since that's going on in China, we need to continue to be very vigilant.
Hopefully, our recent advances of being able to isolate, identify, and characterize the agent, together with the advances in understanding the natural history and pathophysiology of this disease, will allow us over the next year to come back to you and tell you that we now not only have hope and hypothesis, but that we have a real prevention and indeed a real cure. Thank you.
Tony Fauci's boss. And he's the guy I've been going to since 1993 when I came to NIH to seek advice on the thorniest problems. And yeah, I still do.